You're about to experience Healthline, a show where doctors from Makati Med interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with Makati Med. I'm your host, Nicole Jacinto, and this is the show where we try to give you more information. And I also educate myself during the show, and I hope a lot of people get educated about different medical conditions, illnesses, diseases, and how to treat them. And of course, on this show, we get you've got questions, we've got answers, and the answers come directly from doctors from the prestigious Makati Medical Center here in Makati City in the Philippines. Some people watch from abroad. And I'd like to say hello to Alessandra from Madrid. She is usually watching in Madrid, but today she is actually visiting. She's in the Philippines on a vacation. So Alessandra, muchas gracias. You're always watching us. And don't forget if you need to go for a checkup with any good doctors and you want the best care, go to Makati Medical Center in Makati. Okay. Our topic for today is hives. And our guest is Dr. Maria Socorro 𝗛𝗲𝗶𝗶, and she is an allergology specialist in Makati Medical Center. So good afternoon. Welcome to the show, doctor.
Hi, good afternoon, Nicole, and also good afternoon to our viewers and listeners.
Okay, doctor, first of all, thank you for joining us on the show, for allotting your precious time and your knowledge to help inform people out there. So you're an allergologist, so obviously when we talk about hives, we are going to discuss some hives in relation to allergy. Can I ask you, before we talk specifically about hives, can you basically tell us first what happens in the body when we have an allergic reaction?
Okay, allergic reaction is actually the immune response of our body. So if there's a foreign body, normally these are not harmful to our body, but certain patients, certain individuals are predisposed to develop hypersensitivity. So it's hypersensitivity.
Okay.
That's what we call the allergic reaction.
Okay.
So our immune system is just protecting us. So trying to get rid of this foreign body, which detrimental. That's why nagkakaroon po tayo ng mga symptoms like itchiness, sneezing, and so on.
Yes, doctor. Thank you very much for that answer. So, usually there's a foreign body, like if you inhale it or it touches your skin or whatever it is, and usually it's not really harmful, but the body perceives it as harmful. So our immune system kind of overreacts or goes into overdrive. That's why you call it hypersensitivity.
Hypersensitivity.
Okay. Please jump in and correct me anytime if I'm wrong, doctor, because I'm trying to understand the topic better, especially this topic even better. Actually, this is my favorite topic and also the topic that gives me anxiety, allergies. So
can you relate, Nicole?
I can totally relate, and I might ask you for your number after the show because as I said, I can totally relate. So you know what that means, possible patient here or patients I can refer to you. So doctor, are hives a manifestation or type of an allergic reaction?
Hives is actually one of the manifestations of an allergic reaction. But when we say chronic urticaria, it's no longer a symptom. It's actually a disease already. So parang hives can be a part of an allergic reaction, or it can be totally another disease entity.
On its own. Okay, that's great. So, Dr. Urticaria is the name for
Okay, urticaria is actually the medical term for the hives or the wheals.
That's and doctor, can you say that again? We got a little bit
urticaria is actually, can you hear me, Nicole? Can you hear me?
Yes, doctor.
Okay. So
yes,
urticaria is actually the medical term for hives and also wheals. So this is medical term for in the layman's terms of Filipinas, you can term is as imon-imon. I don't know if you're familiar with that term. Hello?
Okay. Let's talk about the the layman's term,
Hello?
or the medical term is, thank you, AJ. Okay, doctor. Okay, so you're back, unfrozen. Are
I'm sorry.
hives I know I asked you earlier if they're related to allergy, but they, as you said, they can be a disease on their own already, chronic hives. Maybe we can circle back to that just a little bit later. For someone like me who's very inquisitive when it comes to things, especially this topic, are
Mhm.
hives always an allergic reaction, or could they be something else? Because I mean, as a specialist, or allergology specialist, do people who have hives, are they always referred to you? Like,
Um,
should you specialists be treating hives?
okay, some patients would be referred not only to the allergologist, but they can be also seen by the dermatologists. So mostly, since it is a skin manifestation, mostly patients would go to a dermatologist than the allergologist. And when these hives are already chronic, when you say chronic, longer than 6 months or 6 weeks already, then that's the time. And especially if not responding to the usual medications, then that's the time usually we get referrals and also patients coming in due to these hives.
Yes. Thank you, doctor. Because I know a lot of people, as you said, it's a skin manifestation. Y- yung imon-imon na sinasabi po, think of
Mhm.
is the dermatologist, medications, and all of that. But if we're going to talk about chronic hives later, if it lasts longer, they usually get referred to you. Like you're the final stop.
Yes, that's the
Sometimes you
usual
should be
thing.
the first stop, but we go in a roundabout way because I guess more patients are maybe inclined to see the dermatologist first because it's a skin thing, or if it comes out in their face, it's more of a, they're used to associating skin problems with a dermatologist. Okay, so doctor, can you describe the appearance or the feel of hives or imon-imon? Like, how are they hard? Are they soft? Are they necessarily always itchy? What
Yeah.
size? Okay.
Okay, so the other layman's term, I think here sa Philippines ng imon-imon is tagulabay also. I don't know if also you're familiar with that. Hi, Nicole.
I'm learning. So,
Ayan.
tagulabay
So
or imon-imon?
tagulabay,
Yes?
tagulabay and imon-imon.
Okay.
So
Tagulabay.
the rashes actually of hives or this tagulabay is characterized by, actually they can come in different sizes and shapes. Mostly they are parang map-like or parang mapa-mapa ang kanilang description. And
Ah,
they usually have swelling. If this is the rash, yung central, there is central swelling. Yung gitna niya maga siya and para siya naka-embossed, nakaangat. And then the sides or the periphery of that rash usually have red color or erythema, or what we call the erythema. And they
yes.
usually come and go, so fleeting in nature, palipat-lipat. Kunyari ngayon andito siya, and then after a few minutes andun na naman sa kabila, may bago ka na namang rashes. And they are usually characterized by some itchiness,
Some itchy.
sometimes burning sensation aside from the itchiness. And usually, those individual rashes would actually resolve spontaneously in less than 30 minutes or less than 24 hours. Kasi kung etong mga the same rashes na ganun ang description, and yet they would not resolve within 24 hours, then ibang klaseng sakit naman na yon. Now,
Okay.
sometimes then, itong mga hives na ito, if the hives malalim. Usually, ang hives kasi kaya siya mabilis maghilom or mag-resolve spontaneously, as if parang walang nangyari doon sa skin mo kanina kung saan may rashes, bumabalik siya doon sa dating anyo ng skin mo na walang naiiwang mga marka, no? Usually, they affect only the upper layers of the skin, kaya sila mabilis bumalik. But sometimes, pag masyadong malalim na, nasa lower dermis na yung affectation ng layer ng skin, that's the time that we get yung parang sobrang namamaga, di ba? Yung nadideform
Yes.
yung face, yung lips,
Yes.
gano'n. So, yun naman, ang tawag namin doon is angioedema. Although, pag sinabi mong urticaria, can be a combination of hives only or hives and the swelling or the angioedema that we call, or both.
Or both.
Pwedeng
Okay.
hives lang siya or angioedema or both. Now, yung angioedema compared doon sa hives, no, mas matagal yon maghilom. Usually, it can last more than 72 hours. That's why, pag kunyari namaga yung lips mo, kahit uminom ka ng antihistamine, the next day, andun pa rin siya, and it would take mga ilang days, mga 2 to 3 days before totally bumalik sa dating anyo yung lips mo or yung eyes mo.
Yes,
So,
doctor.
usually, when the occurrence of these hives or rashes, yun lang yung mo, paulit-ulit lang na na mga symptoms mo ng rash. Kung less than 6 weeks pa lang na nagkakaroon ka ng ganung mga rashes, then we term that as acute urticaria. Pero kung yung rashes mo, nagiging araw-araw na or could be intermittent pero recurrent siya and lasting more than 6 weeks na, that's the time we term it chronic urticaria. Okay? So, usually, dapat chronic urticaria yung term na ginamit natin doon sa natin. Kaya lang, hindi masyadong alam pa ng mga tao na ibig sabihin ng urticaria ka. That's why we use the term chronic hives before doon sa flyers natin.
Okay. Thank you, Doc. So at least, okay, if I can just sort of recap what you said and see if I'm understanding this correctly. Hives, urticaria is the medical term for hives.
Yes.
Okay. And then we also know it as imon-imon or
Tagulabay.
Okay. And then the layman's term, of course, in English is hives or rashes. And they can okay, they can appear anywhere in your body. And then within 30 minutes, like, oh, first it's in my hand. Oh, next it's in my arm. And then they are usually, or they can be itchy, pwedeng hindi.
Yes.
And then they're sort of, as you said, in the middle, it's kind of like hard and swelled up.
Naka-imboost siya. Parang siya naka-imboost. Alam mo yung naka-elevate siya.
Yes.
Kasi swollen yung center ng rash. And then yung paligid niya mapula.
Yeah, okay. And then you mentioned
If you've seen, Nicole, if you have seen yung pag nahigad ka, di ba? Alam mo yung...
I was gonna ask you about higad later.
Yeah. Parang ganun yung itsura ng rashes niya pag hives or yung urticaria na tinitawag.
Yes.
Di ba pag nahigad ka after a few hours, kahit hindi ka uminom ng gamot or antihistamine, nawawala na kaagad siya na parang walang nangyari doon sa skin mo yung time na yon.
Yes, I experienced that. But I was gonna ask you later about higad. But anyway, we'll go back to that. And then when it's less than 6 weeks or it's always occurring, you can call it acute urticaria. Pwedeng may angioedema. Yung parang, I guess what I want people to understand is, some people think, you already mentioned it, that it's only on top of the skin or the first layer. But when it's angioedema, it's deeper. So, parang, just to make things simpler, parang may hive din ba sa loob? Parang may
yes. Yung hives niya is umaabot hanggang doon sa lower dermis, sa pinaka lowest most part ng skin natin. That's why mas matagal siyang mawala. And usually sa mga mucous membranes, yung mga maninipis na area ng skin natin, mas doon prominent yung swelling kasi manipis nga, like sa eyes, di ba? Minsan nakagano na yung eyes mo. Yes, eyelids mo pala yun. And then the lips kasi manipis lang to. That's why pag nagkaroon ng hives doon, sobrang magang-maga siya.
I was going to ask you, Doctor, earlier, what parts of the body do we get hives in? But you're mentioning it now. Maybe you can just go through it really quickly. What parts of the body?
Actually, any part of your skin can be affected. Sometimes you can have hives doon sa scalp pa nga eh.
Yes. Yes.
So, any part of your skin can be affected. Even doon sa mucosal tissues, no? Even sa throat, pwede ka rin magkaroon ng pamamaga din doon.
Nakakatakot when it's inside.
Yes. So that's the time, yun yung mga doon natatakot yung mga tao. Yung parang pag medyo parang hindi sila makalunok na or parang feeling nila pati yung lalamunan nila or sometimes pag sobrang thick nung pantal sa neck, no? Doon sila nagpapanik na. That's why they go to the emergency room na.
Yes, doctor. And okay, can I ask you what triggers hives? Again, is it always necessarily an allergy? Like you mentioned higad. Diba sometimes if a higad will crawl on you, it will resolve on its own, as you said. Then you see a higad is a caterpillar for those. It's a black caterpillar, and you know sometimes when you're out there in nature. That's why I'm afraid of nature sometimes. They'll crawl on you, and then they'll leave these little quills, like black quills that you pull out. And then, of course, that part gets swollen and itchy. And I mean, is that an allergic reaction or is it something else? Is the allergic reaction always, can it be localized or is it always a systemic reaction, a systemic allergic reaction when you get hives?
Yeah. For that example of nahigad, no, it's actually a contactant allergen. So, when you say contactant, doon lang yung sa area kung saan siya usually nag-contact, doon usually nagkakaroon ng rashes, no? But sometimes sometimes kasi pag nahigad ka na, nandun na, nagkakamot ka na, so you can spread the other hairy or that thing na nagsupas ng that's why nagiging
they tell you don't scratch.
Yes.
So, doctor, you can spread it by scratching.
Yes, also.
And like mosquito bite also, sometimes, people allergic to it.
Yes. Also, those patients with chronic urticaria usually can occur only doon sa certain parts ng skin niya, but sometimes it progresses, no? That's why nagiging generalized siya. That's why nga yung iba nga po, from a simple rash lang sa hand, and then after a few hours, dumadami na siya, kaya siya nagiging generalized. Now, with regards to the trigger, no, yung kaninang tinanong mo kanina kung ano yung mga triggers ba ng urticaria. So, depende. When you say acute urticaria, so usually we think of a trigger na transient lang siya kasi acute lang yan, no? Once you remove that trigger, then you don't expect the rash to be recurrent. So an example of this, now, mostly of those patients who had acute urticaria, by the way, Nicole, almost around 20% of the population will actually experience acute urticaria in their entire life.
So that's a demographic of the whole population of the world will experience acute urticaria.
Yeah, and then it can affect any ages, no? Any ages, no? All ages can be affected by acute urticaria. So it means one out of 5 people, no, can experience any time of their life with this acute urticaria. Now, the triggers of acute urticaria, mostly around 50% of these are idiopathic. When I say idiopathic, it cannot be explained. Parang sinasabi ko sa pasyente, sometimes you cannot identify the trigger, basta makaka-experience ka ng ganyan, and then after a few weeks, nawawala na lang siya without any explanation. But other causes or other triggers can be an acute infection, especially mga viral infections. That's why some patients, especially yung iba, di ba, pag nagkakaroon ng mga viral infections, naglalagnat, nagkakaubo, nagkakaroon din sila ng mga rashes like the hives.
Sorry, doctor, can you say that? Can you say that again, just so that we can hear it more?
About the viral infections. Hello, Nicole.
Yes, doctor. Yes.
Okay. So
yes,
some patients, no, like around 20% of this acute urticaria will actually be secondary to a underlying viral infections. Like if you have an upper respiratory tract infection, no, sa mga bata, common yan. Pag may ubot sipon, may lagnat, they can also have this acute urticaria. So in that way, hindi siya talaga siya parang allergic reaction, but there are substances which are being produced by these viruses na nagko-cause ng release ng chemicals causing these rashes. So hindi rin lahat ng Yes,
I mean that's great to know. Yes, doctor. Can you hear me?
Yes,
that's great to know, doctor. Because okay, I was going to urticaria or acute urticaria can be caused by another condition or illness. And as you said, let's say you have an upper respiratory system. That virus that you have, let's say you have an upper respiratory system. Let's say you have an upper infection. That virus might be releasing some substances that triggers your immune system na, hey, we don't want this, so you get an allergy. Okay.
You get those rashes, it's not necessarily an allergic reaction.
Okay, not that. Okay. And then, doctor, you also said sometimes it's transient, so meaning not like it's something you're exposed to temporarily, like let's say smoke or I don't know, sometimes the weather, there's dust,
there's something in the air that can also trigger that one, no? Na transient din lang. Then after mawala na siya, then di na nauulit yung pamamantal. Okay?
Like there's ash now. Oh, sorry, go ahead, doctor.
Then also, aside from those infection, you can also get acute urticaria from an exposure to a medication acutely. So kunyari, you were given antibiotic, di ba? So usually antibiotic are given 7 days, no? So during the time, kunyari in the course of the treatment, nagkaroon ka ng rashes, then of course we cannot totally rule out the presence of a drug allergy in those patients. So sometimes when we stop the antibiotic, then nawawala na yung pantal. That's why it's only transient kasi when you stop or you remove the exposure to that particular trigger, nawawala na rin yung occurrence or recurrence ng urticaria.
Okay. Great, doctor. And I mean, I suppose that applies to other medications as well. Let's say NSAID or yung painkiller ban.
Actually, NSAID is one of the top common causes of acute urticaria. So these are the group of pain relievers, what we call the non-steroidal anti-inflammatory drugs. And they usually would present with swelling, yung sinasabi ko angioedema. Yes. So they would present with swelling of the eyes or lips rather than, or mas common yung presentation nila na may angioedema than the hives itself. A few would have angioedema also and also those hives. Okay. Now, also, Nicole, a food allergy can also cause an acute urticaria. Remember, this is an acute urticaria kasi once you stop it, diba? If it's the rash is from the food allergy, it should be reproducible. Meaning, kunyari, if you're allergic to the egg, every time nakakain ka ng egg, doon lang dapat lalabas si pantal. Hindi yung ngayon ka kumain tapos the next day pa lalabas. Parang imposible na yan. And then kung mauulit kang kakain ng egg, hindi siya lumabas, then maybe it's not the egg causing yung urticaria mo. But yes, hindi po nagkukos ng chronic urticaria ang food allergy. More likely, an acute urticaria is the most common presentation ng food allergy. Kasi di ba, minsan pag napansin mo nang wala ay nakakakain ka ng certain na food, tapos parang every time na kinakain mo to, parang nagra-rashes ka. So, ikaw mismo, kahit hindi ka pa pumunta ng doktor, iiwasan mo na yung food na yun, and then, mawawala na lang siya. So, because you stop eating that particular trigger na. So, ang food allergy would usually present acute urticaria rather than chronic urticaria, not unless talaga wala kang ka-clue na nagre-react ka na pala.
Maybe it's not this food, it's that. Yes. It's the combination of food. I mean, not the combination, but you might be eating a lot of different types of food and you mistakenly thought it was the egg when it was something else that you were eating.
Yes. And also, Nicole, this acute urticaria or the hives itself, ito yung tinatawag naming hypersensitivity reaction na immediate. Meaning ng immediately, few seconds or few minutes or within 1 to 2 hours of exposure mo doon sa possible trigger, talagang lalabas na yung symptoms. That's why, kunyari, ngayon ka kumain nung sinasabi mong allergic ka na food, tapos lumabas pa siya the next day, parang hindi na siya related doon. Hindi na siya highly likely from that food. No? Kasi nga, it's an immediate. Kaya nga pag nakainom ka ng gamot, di ba, ang bilis niya.
Exactly, yung food allergy, doctor. Let's say we know people or we get a food allergy. Within what window? Kasi a lot of people like, how fast, how long do I have to be, like, oh, I ate that. I think I'm allergic to it. Sometimes it happens, no? The restaurant doesn't listen to you or whatever it is, nahaluan ng egg or whatever it is you're allergic to. And then you start feeling weird and then you're anxious. Like, should it come out within 30 minutes, a few minutes? Like how long?
Even few minutes lang, 1 to 2 minutes, 30 minutes, 1 hour, 1 to 2 hours, or maybe within the first 6 hours, dapat lumabas na kaagad siya. So, minsan nga, hindi mo pa nalulunok yung pagkain mo, no? Nagkakaroon ka agad ng itchiness dun sa mouth area mo, eh.
Yes. Doctor, I mean, I'm glad you said that because I want to highlight that some people think, wala lang, it's okay. But in a lot of places for people who are allergic, let's say food allergies, there seems to be only a few of us like really reminding people like, kung allergic siya, let's say siya shrimp, don't mix it, with the the oil or whatever you cooked it in, or don't put it on the same plate and say, oh, pwede na yan, tanggalin mo na lang yan. Because as you said, it could just touch your mouth or your tongue,
Yes.
and bam, there it goes. And doctor, also, there are people, I heard the nut allergy is the worst, the peanut allergy is the worst, because if you just smell it,
Yes.
you can have a very bad
Yeah,
reaction.
actually, the allergic reaction can the route of entry to our system is actually through the skin, through the nose, through the mouth, and through the eyes, no? Yun ang mga different routes ng kung saan pwedeng pumasok ang allergen sa katawan natin. So that's why you can hear something na pag na-inhale lang nila yung allergen, talagang pwede na silang mag-react.
Okay, kasi minsan sinasabi nila maarte ako, but really, doctor, like, here, gaganunin yung food na allergic ako. I'm like, I don't want to even smell it. Because actually, when you smell, doctor, correct me if I'm wrong, when you smell something, that means there's a molecule of that substance that actually entered your nose.
That's
Okay, I mean, you
correct.
can't smell it unless, so imagine if you smell poops, yuck. But it's true, right? It would enter. Okay. So anyway, doctor, I think we have to take a quick break. But when we get back, let's engage more in the chronic hives and how a doctor like yourself, diagnoses it, treats it, and all of these things. I'm really having fun. I feel so engaged with you. I hope the audience feel the same. And I do have a few greetings to make when we get back, because people have just like texted in like to say hi and all of that. So we'll just take a short break and we'll be right back. Don't go away. This is Healthline with 𝗏𝗏𝗏𝗏 Med. I'm your host, Nicole Jacinto. We are here with Dr. 𝗏𝗏𝗏𝗏𝗏𝗏. What would you prefer me to call you, Doctor? Dr. 𝗏𝗏𝗏𝗏𝗏𝗏?
Michael. Just call me Michael.
Michael. Okay, that's a nice name. And I can see where it comes from in your name, the Maria Socorro. That's really
Yeah.
cool. Okay. All right, everybody, just hang on and we'll be right back. Take a break, maybe go to the bathroom or take an antihistamine if you're getting itchy. I'm just kidding. Okay, we'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗏𝗏𝗏𝗏𝗏. Available for outpatient care services, our 𝗏𝗏𝗏𝗏𝗏 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗂𝗶𝗵𝗹𝗁 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗂𝗶𝗵𝗹𝗁 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗂𝗂𝗶𝗵𝗹𝗁.
You're back with Healthline, keeping you healthy, moderated by Nicole Jacinto.
Hi, everybody, and welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto, and with us today is Dr. Maria Socorro 𝗂𝗶𝗶𝗶𝗏, or Dr. Michael. Thank you for being on the show again, Dr. Michael. And we've been talking about hives, allergy triggers to hives or urticaria, and we've been getting to the point we're talking about chronic hives. We've talked about what triggers hives, and doctor is here to tell us about chronic hives because it's something that, as you said, 1 in every 5 people or persons in the whole population will experience chronic hives at some point in their lives.
Oh, Nicole, that's for acute urticaria.
Sorry, acute urticaria.
For
Okay.
acute urticaria. But
Okay.
when we say chronic urticaria, it usually affects about 1 to 5% of the population.
Wow,
And
that's
yes.
still a big, okay, chronic urticaria. So, doctor, let's get into it. What are the usual or even unusual triggers of chronic urticaria? The kind of hives that last for more than 6 weeks.
Okay. So when we say chronic urticaria, we should think naman ngayon ng trigger na it could be present throughout the environment almost daily. So meaning na andyan lang sa environment ng patient. That's why she is exposed there daily. That's why almost daily din yung kanyang pamamantal. Or it could be in the system of the person herself, no? Kasi not all chronic urticaria is allergic in nature lang. Okay, so eto naman. When we say chronic urticaria, but around 80%, when you say chronic urticaria, dalawang klase naman yan. Okay? Meron tayong tinatawag na chronic spontaneous urticaria. And when you say chronic spontaneously nag-a-appear siya with or without a known cause. No?
Okay.
And then the other classification naman ng chronic urticaria is chronic inducible urticaria. There is a certain trigger na nakakapag-induce ng pag-appear ng kanyang rash. So, magkaiba yung dalawang yan. Okay, now around, mostly 80% of the population will have this chronic spontaneous urticaria. And around 20% lang ng population will have, those patients with chronic urticaria will have this chronic inducible urticaria. Now, we go muna doon sa isang inducible. Ang katulad niyan is yung tinatawag nating dermatographism. Diba, nakakita ka na nung taong pag sinulatan mo yung skin nila, or what we call the skin writing, umaalsa na yung skin nila, nagkakaroon na ng rash. Kung anong yung itsura, kung anong sinulat mong letter dun sa skin nila, ganun din yung lalabas na pantal. So when you write letter M din yung pantal na lalabas. So that is what we call dermatographism or the inducible urticaria. So some patients then, pag come in contact with a cold object or cold thing, then, kung anong shape ng malamig na thing na yun na nilagay sa skin niya, no, nagkakaroon din ng ganung shape na pantal. Or pag na-expose yung pasyente sa isang malamig na lugar, nagkakaroon din sila ng pamamantal. So, these are examples of inducible urticaria wherein lumalabas lang yung pantal pag na-expose siya dun sa certain trigger yun. Okay? Yung sa chronic spontaneous urticaria naman, no, kaya nga tinawag na spontaneous kasi kahit wala kang trigger, no, basta-basta lang siyang lumalabas. So, around 40% of these patients with chronic spontaneous urticaria has actually an underlying autoimmune disorders, no? Yung iba doon, ang kalimitan underlying disorders ng chronic spontaneous urticaria is an underlying autoimmune thyroiditis. No? yung may mga thyroid problem, lalo na kung meron siyang autoantibodies against the thyroid gland, even though normal naman yung thyroid hormones nila, they usually present with this chronic urticaria. So isa yun sa mga autoimmune disorders na pwede mag-cause ng chronic urticaria. Some other autoimmune disorders, like if you have a systemic lupus erythematosus or what we call the SLE, can also present with chronic urticaria then. So, ano ba ibang mga possible causes ng chronic urticaria? If you have also an infection na hindi mo alam because wala kang kaalam-alam dahil wala namang mga signs and symptoms na pwede mag-point to a possible infection, it can also cause chronic urticaria kasi naandyan lang yung infection sa loob ng katawan mo. And therefore, pwede kang magpantal talaga almost araw-araw na lasting more than 6 weeks already. So, here we can have yung mga hepatitis B or hepatitis C infection, di ba? Nasa dugo mo yun eh. So, you can have that one. If you have also yung mga pulmonary infection, no? Like if you have this untreated tuberculosis, which is the most common infection ng lungs natin dito sa Philippines, then, no? You can also have this chronic spontaneous urticaria. Okay? Or yung iba, kung meron mga underlying cancer or malignancy, but I'm not saying that all patients with chronic urticaria has underlying malignancy. Depende po yun sa mga simptomas na pwede namin ma-elicit dun sa patients, no? Depende sa pag-interview namin. We always think of an underlying medical illness aside from an allergic reaction. We also have this allergic reaction as a cause ng chronic urticaria. So if you have this contactant or inhalant aeroallergen, yung mga nalalanghap natin ng mga airborne allergens, no? If you're exposed to that airborne allergens daily, or kung hindi mo man masingkwat, mag-touch ng skin mo, it can also trigger that chronic hives or chronic spontaneous urticaria. Okay, so
Doctor, okay, what you yes, sorry, go ahead. Did you want to say something more? Or okay, yeah, so from everything you said, I kind of just want to I picked up 3 things, and please interject anytime and correct me, my terms, anything it is. When it comes to chronic urticaria, it can be exposure to it daily. Like let's say you used a cleaning agent and you're not even aware, no? It's there pala in your room or your house.
Or if you have a lot of house dust mites at home.
Yes, no? Yes.
Or if you have an allergen like a dog dander or cat scare, which you're exposed to, you can have this almost daily na pamamagitan.
And you didn't even realize it, no? Or some type of fabric freshener, perfume, whatever it is, and then it's always there. That could be it. Or I don't know, maybe possibly if you're eating the same food every day that you didn't get to realize it.
Yeah, but that's very rare then. Not unless talaga hindi mo talaga wala kang kakulong na you're reacting to that.
Yes. And then there's another there are other things that can cause it as well or trigger it, and most of them can be underlying illnesses that have not yet been discovered by the patient or the patient's doctor.
Any chronic infection sa katawan natin pwede siyang cause ng chronic urticaria.
So let's say, doctor, you had your cataracts done or something, an eye operation, and there's pala a small infection there. Then you started experiencing allergy for 2 months. Could that be it? Because there was a small bacterial infection that they didn't catch? Something like that?
Yes, pwede rin po yan. Like even if you have a foreign body, no, sa katawan mo, like may mga implants, no?
Yes.
You can also be reacting to that, no? So, isa yun sa mga tinatanong namin when we do the history sa pasyente. Yun.
So, doctor, it's just like to stress again to people, it's important to go to doctors. And when we're talking about allergy or urticaria, whether it is an allergic reaction or not, or an underlying disease, it is important if you have chronic urticaria to go to an allergologist or an allergist.
Kasi diba, pag nagkaroon ka kasi ng pantal, ang first mong iisipin is allergy lang. No? But not with the chronic urticaria, hindi po lahat ng nagpapantal is allergy lang. So we have to trace underlying illness po that can trigger that urticaria.
And so, doctor, it comes to like, this comes to like, you're talking a lot about interviewing. That's part, is that, how do you diagnose chronic urticaria? I guess that's part of it first. You interview.
Of course, history and also the physical examination. That's why when patients would come to me, ang kanyang chief complaint, no, nagpapantal po ako. Hindi po ako kaagad naniniwala na pantal. Kasi when we say pantal, no, yung ibang tao, they would think na itong klase ng rash to, pantal to, and this kind of rash is pantal. I always ask kung meron ka bang mga documentation ng mga previous rashes mo, lalo na kung during the time na nag-consult siya sa akin, wala akong makitang rash. Then I usually ask for a copy of the picture ng kanyang rash. Kasi most of the time, mali. Minsan yung ano nila, yung sinasabing pantal eh. But when I see this particular rash, then, oh yeah, sige, that's chronic urticaria. Okay. Or sasabihin ng pasyente, kanina po, doctor, meron akong rash dito before ako pumasok dito sa room nyo, pero ngayon wala na po. So that's a hint also that I'm also entertaining a chronic urticaria or an urticarial rash. Kasi di ba sabi ko, siya, relapsing or fleeting nature, pabalik pa, on and off, and walang naiiwang marka doon sa area kung saan nagkaroon ng.
So some advice to patients who are, let's say you're waiting for your turn in Dr. Maiko's office, and then right before you go in, it disappears. Then you're like, oh, wala na, I don't have it anymore. No, it's okay. Go see Dr. Maiko because that is a sign. Because some people feel embarrassed, like, oh, it disappeared. Or they go to the ER and then, oh, it disappeared. No more na. But actually, that's how it behaves. So they still should tell their story and what they're exposed to and all the questions that doctors like yourself ask any ER doctors. Okay. So earlier you mentioned that chronic urticaria really it will affect angioedema will affect about, as you said, 1 to 5% of people.
No, the chronic urticaria can affect 1 to 5% of the population.
In the whole population, and that's worldwide. And we don't know why it happens. Sometimes, like when you said it's idiopathic, you don't know what the exact cause is, or maybe you don't have enough time to spend with one person and their daily thing to follow it. Are there should they start well, maybe I'll ask you later advice on how would they chronicle it? Like, today I did this, I ate that. Is that something that you ask your patients?
Yeah, it's part, no? Lalo na kung ang patient, ang una nilang parang sinasuspect na cause is food eh. Okay, so if the patient is really insisting that it is a food allergy, then one of the things now we advise is to do a food diary. Okay? Like for example, you have to list what are you eating in the breakfast, during breakfast, no? What time did you take it? And then what time did the rashes appear, no? Para we see kung ano yung interval, no? Is there a correlation with the intake of the food and then the appearance of the rashes? Kasi sabi ko nga sa iyo, kung medyo a day or two after taking the food, no? Medyo hindi na yan related.
Yeah. And then sometimes anyway, we can talk about that when we talk about managing at home. There's elimination of certain things in your diet just to make sure that's it. But doctor, okay, so now you've diagnosed someone with chronic urticaria. How exactly do you diagnose? Well, you mentioned it, not you see the picture because you know the pattern, and then the behavior, how the patient felt, all of that. Are there also specific, maybe like other kinds of tests that you use? When you diagnose, yes. Okay.
So depends doon sa type of urticaria that the patient is experiencing. So if we have this acute urticaria, we have what we call the routine diagnostic test and then the extended diagnostic test, no? We usually do not perform any routine testing for patients with acute urticaria because we usually expect, no, that these rashes would be resolved in less than 6 weeks. And then if we think that if the cause is just transient, like if you have an URTI, upper respiratory tract infection, in less than a week, magre-resolve na siya, then we expect that those rashes will be resolved then. So usually in patients having acute urticaria, we don't have any test. Kaya minsan magtataka yung mga pasyente, no? Bakit di mo man lang ako binigyan ng test, no? O baka isipin nila you're not a good doctor because you did not request for any test. But I usually explain that to my patients that we usually expect na in less than 2 weeks nga magre-resolve na siya, no? So since the triggers are usually transient, but if I give you the medication for this number of days and yet you completed the medication and then bumalik siya uli, balik ka uli sa akin kasi more likely, ikaw na yung taong na more likely mag-experience ng chronic urticaria. So kahit wala pang, parang hindi pa umaabot ng 6 weeks, no? Minsan kasi, you cannot wait pa for 6 weeks para lang ma-fulfill mo yung criteria ng chronic urticaria, no? Na medyo mahirap magkaroon ng araw-araw na pantal. So, but, yun nga, within 2 weeks treatment, no, we usually expect that this acute urticaria would resolve spontaneously and with treatment. But kung nagre-recur siya after the 2 weeks, more likely, ito yung mga taong mag-experience ng chronic urticaria. Kasi nasabi ko na kaagad sa pasyente ko, you can take again this antihistamine but come back because we have to do extensive or extended. Yes. So yung minsan, but sometimes, kunyari, we are suspecting that the cause of the urticaria, acute urticaria of the patient is an infection, like kunyari, may urinary tract infection ka. So we can test for urinalysis, or if you have this pneumonia, kunyari, no? We can request for chest X-ray or CBC at least, no? Yung mga usual na mga lab test lang. So if we are considering an parasitism, no? Kasi ang parasites then can also cause urticaria then. So kunyari matagal nang nag-urticaria, ang parasite can also cause chronic urticaria. So if we are suspecting that one, then we can request for mga fecalysis. That's our routine test, no? But for extended test, we usually, for chronic urticaria, we do both those routine diagnostic tests or CBC, urinalysis, chest X-ray, if warranted, based doon sa history ng patient. And also, yung mga thyroid autoantibodies, thyroid hormones, and at least yung anti-nuclear antibody, no, we do that, we request for that. And if we are considering a chronic infection, we can also, like the hepatitis B and C, we can also request for mga hepatitis B and C screening.
And doctor, these are all blood tests?
No, mostly these are blood tests, but sometimes I request for imaging studies like the chest X-ray, and also sometimes yung full abdominal ultrasound if I'm entertaining mga infection then, no? Another infection which can cause chronic urticaria also is the H. pylori infection. And this H. pylori infection usually causes the ulcers or yung patients na may mga gastroesophageal reflux disease na matagal na they just think na it's just a simple hyperacidity. But then again, meron ng mga ulcers pala doon sa loob. And the bacteria which can also cause these ulcers are those H. pylori infection. So sometimes if the symptoms or the patient has symptoms which can say that the patient can have that some forms of ulcer, then I also include yung extended workup, which is the H. pylori testing.
That's very thorough, doctor. I mean, you go even into H. pylori if someone has ulcer. See, you can connect things. You have GERD or gastroesophageal refluxive disease, and you've had it for years. And now maybe you have an ulcer and it's there, and then you can treat it this way. I mean, you would also work hand in hand, maybe at certain points with let's say a gastroenterologist.
Yes.
You really look into it if you find that it's necessary. But first, and then you, as you're saying, the patient can come back. Maybe, let's say it's not working. Even, what if the patient comes back in a week and says, I'm really itchy. Parang this isn't doing anything. I mean, the basic treatment actually is you give antihistamines.
Yes, we counteract the histamine, which is one of the major chemicals being released during the formation of your hives or the pantal.
Because as you said, doctor, it's your immune system. It's the patient's immune system going into overdrive. And when it tries to get rid of foreign bodies that it thinks are harmful, sometimes they may be, sometimes they're not, it releases histamines. And that's what gives you all these symptoms. No?
Yes.
Okay. Doctor, can chronic hives, you've already told us that they can be indicative of other diseases or illnesses. Can the treatment of chronic hives have its own side effects or risks or complications, or can they cause other diseases as well if you have chronic hives?
Chronic hives per se causing another disease, parang it's not. no?
That's okay.
There is an underlying disease that's causing the chronic hives. So parang hindi siya baliktad. So that's why if you have these hives, you have to dig into your history, to your physical examination to know the cause. So actually, the workup of when you say what are the tests, no, it's not actually diagnosing the patient. It's actually looking for what are the things or the underlying diseases causing the chronic hives itself.
So again, you're acting like a detective.
Yes,
The roots.
that's why when we see patients, when you are waiting in the waiting room for your turn, wag kayong magdasal na ang tagal-tagal naman nagagalit na yung mga pasyente. Kasi we need to really dig into the history of the patients. So that when it's your turn, di ba? Hindi naman kayo din lugi.
When it's your turn, if the doctors talk to you for an hour or more to really see what's going on with you, then you step out and you're like, then you see the angry faces looking at you.
Yes.
But you have to do that. Yes, that's good to explain that to some patients. Like, of course, if the doctor arrives on time for their office hours and you have an appointment, sometimes it's moved a little because they may be dealing with a patient who's worse off than you. And has more information to give, or they need more information for that patient. Doctor, when it comes to the treatment of chronic hives, you said you give antihistamines. What are the side effects, or are there any side effects or other things? Like, could it then give the patient, the side effects that maybe are not desirable for the patient, and then could it cause other could it affect, let's say, the medicines you give? Can it affect the liver, kidneys, that kind of thing?
So the drug of choice for the treatment of chronic hives or chronic urticaria is actually an antihistamine, no? Now we have two types of antihistamine. We have the first generation antihistamine and second generation antihistamine. The drug of choice for patients with chronic hives or urticaria is actually a second generation antihistamine. So these second generation antihistamine examples nito are loratadine, cetirizine, levocetirizine, 𝗛𝗲𝗹𝗁, bilastine. So that's why they are second generation. No? They don't have those side effects, which is being experienced from the first generation antihistamine. A very good example of first generation antihistamine is your diphenhydramine.
We want diphenhydramine.
Yeah, so that is sedating or nakakaantok talaga, or minsan hilong-hilo ka talaga sa diphenhydramine. So we usually don't give that diphenhydramine to patients, no, na as maintenance medication nila or as a daily medication for the chronic hives. We usually choose yung second generation antihistamine because we don't want you to be not functional, di ba? Hindi ka na nga functional because you are having the chronic hives, tapos bibigyan ka pa namin ng sedating antihistamine or totally talagang nakahiga ka na lang or tulog ka na lang sa trabaho mo, di ba? So that's why, and also sometimes,
but they still have a sedating effect, I find.
So some second generation antihistamines would have a different effect. So to some patients, like some certain cetirizine, they have a mild sedating effect pa rin, no? So that's why I usually ask the patient kung ano na dating mga nagamit nilang antihistamine and kung ano bang na-affect ba yung activities nila. So because I don't want to give that one anymore, kaya nga nandiyan na yung patient sa'yo, no? Sometimes pang ilang doctor na kami, tapos you are not giving hopes to this patient. So you have to give them something na pwedeng makaka-stop ng limitation ng kanilang activities because of their chronic hives. So yun. And also sometimes we choose also certain medications which is best for the patient, especially kung meron silang underlying illnesses, no? Those with liver disease already, those with kidney problem already, no? So we usually choose a certain antihistamine for them.
That's why you ask, no? That's why you ask also, what other medicines are you taking? And then some people are like, but that's why you ask it. Because you're balancing everything and treating them. Okay. Doctor, we're going to talk about, I will ask you something about hives in relation to severe allergic reactions or anaphylaxis. When you have hives or chronic hives, should you be afraid?
Sorry.
Should you be afraid that it will somehow lead to a severe
Okay. When we say chronic urticaria, is actually this should be differentiated to a disease what we call the anaphylaxis, no? Ang chronic urticaria kasi ano lang siya, urticaria lang talaga and some swelling na pabalik-balik-balik. So that's the isang disease entity. The hives na makikita mo sa anaphylaxis is just a symptom. So isang part and partial part lang siya ng anaphylaxis. But the chronic urticaria is a different thing na.
So
Okay?
if you have or chronic urticaria, you don't have to worry that that specific chronic urticaria that you have or whatever's causing it will lead to a severe allergic reaction on its own. I mean,
Yeah,
that's-
kasi diba, if you have already chronic urticaria, definitely you will be given a medication na usually we don't give a medication or antihistamine na 1 to 2 weeks lang. Definitely hindi siya mag-resolve with just 1 week or 2 weeks treatment with antihistamine. So sometimes we give it on a longer period of time. Sometimes we maintain it, no, for several months, no, because that's the nature of urticaria. Hindi yan pwedeng inuman ng antihistamine as needed lang kasi wala. Ganon-ganon din siya, pabalik-balik din siya. So that's why if you are taking already upon the advice of your allergologist or your doctor that you have to take this medicine, then there should be no worry na magkakaroon ka ng any difficulty in breathing, no? Yung mga ganon. But the other one, yung hives as a symptom, as part of the symptom of anaphylaxis, ibang usapan naman.
yes.
Kasi
Okay.
it doesn't recur na pabalik-balik na nangyayari na mayroon kang hives at the same time mayroon kang difficulty in breathing. So anaphylaxis it's a more of an acute disease or disorder than the chronic urticaria.
The urticaria is just a symptom that that you are when it comes to severe allergic reaction or life-threatening or anaphylaxis. The urticaria is just one of the things, or the allergy
Yes.
one of the
Because
things.
you can have also anaphylaxis without a skin manifestations.
Yes. Okay. Can we go into just, maybe describing quickly what anaphylaxis is, and if you notice it in yourself or, someone that you're with, maybe just how to identify that, hey, this is progressing,
Yeah.
and we should take the person to the hospital, or what do we do before we even go to the hospital?
Okay, so with regards to the anaphylaxis, we usually have 2 criteria for that. The first criteria is that if you have a skin or tissue manifestation, mucosal tissue manifestation, meaning sa skin mo, after an exposure to a likely allergen, plus one or more of the following. You have respiratory compromise, nahirapang huminga. You have gastrointestinal symptoms like abdominal pain, vomiting, diarrhea, and also there is cardiovascular symptoms like you have nawalan ka lang ng malay because bumagsak na yung blood pressure. So you have skin manifestation plus either of those 3. So that's one of the criteria after exposure to a likely allergen. The second criterion naman for anaphylaxis is that if you already have a known allergen, tapos you have sudden drop in your blood pressure, or meron kang stridor or yung parang nagsara yung airway mo, stridor or nagsara na yung airway mo, even without the skin manifestation, then we can already call that is anaphylaxis.
And doctor, when you say stridor, you're referring to the closing of your throat.
Closing of the upper area.
And is one of the ways to test it's like if you say like you can't
iba ang boses mo, di ba? Parang ibang-iba na from the usual na voice mo because magang-maga na doon sa loob.
Yes. So that's one way to test it, like,
yeah.
Okay, sorry, and I'm scared doing this. I just memories, PTSD. Really. And also, so those are some of the things that you can do. What should you do if someone or you are experiencing that? You accidentally got exposed to something, that a known allergy, or you're just experiencing this suddenly. What can you do?
So if you already you have already previous experience that you have already anaphylaxis, it is right that you have to carry already an epinephrine kit.
Yes.
Because meron ka na experience, would you wait for another episode of anaphylaxis? So dapat meron ka na ng epinephrine. so that even without going pa, or kasi minsan traffic, no? So
Yes.
even malayo ka pa doon sa hospital, then you can already inject your epinephrine. Okay? But for those patients na wala pang kamalay-malay that they are experiencing that one, of course, the first thing is to go to the hospital and bring yourself there. Wag na pong mag-antay, no? Yung iba, kumakain pa ng asukal, ano ba yung walang mga scientific explanation yung benefit.
It's funny you said that because I've heard that and I've done it. But yeah, yes, doctor. Time is of the essence here, no? Kasi hindi ka na makahinga, you can't breathe anymore. And as you said, you said epinephrine. There are EpiPens in other countries. Epi short for epinephrine. Why don't we have it here?
Okay,
That's my
Nicole,
question.
yeah, so I have to correct that one. We have already a supplier of epinephrine here in the Philippines. So if hindi nyo po alam, it's just that you have to really consult your allergologist so that you will be provided a prescription, and then from that you can be given also a contact number of the supplier of the, that's for emergency purposes also.
And
Meron
then,
tayo dito.
meron, okay, I'm going to...
Aside from the sa mano-mano, di ba yung vial, you usually have epinephrine, we have yung vial na talagang you have to break the glass pa before you can inject. You have to aspirate the epinephrine and inject it in the thigh. Pero meron na rin tayong epinephrine here sa Philippines.
That's okay. Okay, so we have always had a supply of epinephrine, but you have to have they're glass bottles, maybe one or two. The doctor gives you the dosage, no? Then you have like a small syringe, and then the thing is lang, when you're panicked or you're panicked and they're not trained, you have to tap the bottle to make sure there are no bubbles. You break the bottle, you stick the syringe in, you suck out the medicine, then you inject it in the arm or something. Sometimes it can just, you know, everyone is freaked out and you're not sure, because with anaphylaxis really comes anxiety and an impending sense of...
Agree. Oo. Kung kami nga din, minsan, no, ako nga, minsan nabuhat ko pa yung, I was pregnant and then my patient is having anaphylaxis. You know what? I was able to carry her from a wheelchair to the bed, to the examining bed. So that's the adrenaline rush. No?
Yes. And when you're experiencing that, there's like, I mean, to be fair to patients who have allergy, the friends and the family, don't take it lightly, because the patient is getting anxiety. And this is part of it, because your body's telling you you're dying or you could be dying. So there are these chemicals being released and the patient is really freaked out. But now we have the EpiPen or the epinephrine pen. As you said, just go to your allergologist and you get the prescription for it. And if I can just tell the audience, the EpiPen, I'm sure the others in other countries know, it's like, it's an injection that's ready to go. There's a cover, you take it out. I haven't seen one in a long time, but you jam it.
I didn't bring my
Yes,
EpiPen.
still the leg, no? You jam it in the leg.
Sa thigh siya. Sa thigh, not sa leg.
Don't bother taking off your clothes, kasi that is...
you can actually inject that even though you are wearing jeans, no? So sa US, kahit naka-jeans ka, pwede mo siyang
And sa thigh, ha, kasi that's made for emergency purposes, where you're alone or mag-isa ka lang, or nobody knows how to, you know, aspirate the epinephrine and all. So you jam it in your thigh. It helps you breathe. It's a shot of epinephrine. It's like when you see in the ER movies, bang, to help you raise your blood pressure. But you still have to go to the hospital, right, Doc?
Yes, after injecting, you still have to proceed to the emergency room for proper assessment.
You can't just say, oh, okay lang yan, you know. Okay, back to chronic hives. How can you, this is part of an allergy or something else, how can you manage chronic hives at home? Like, okay, I've gone to you, doctor, you've given me medicine, the treatment, but I'm still getting it. It bothers me. How can we help manage? Are there other ways to help manage the chronic hives? Because, okay, go ahead.
Actually, there's none. You really have to be religiously taking your antihistamine. So, whatever the dose, no? Kung ano yung binigay sa yung dose ng iyong prescribing doctor, you have to follow it. Ang problem kasi, sometimes those patients na were given already advice to take it regularly, no? They still don't follow. So that's why even after a week or 2 weeks of treatment, pabalik-balik pa rin yung pantal. So I usually tell my patients that I expect you not to be having some rashes already in 1 week time or even few days, no? Kung the dose I'm giving you is already enough to control, then you should be expecting relief, no? Sabihin, in 24 hours. So usually, di ba, the antihistamines are being given once a day because we
Yes.
expect the effect of that is good for 24 hours. But if the patient is coming in sa akin, ako na yung pangatlong doktor, and then I ask the patient, ano na ba yung pinanggalingan yung treatment? So, kunyari, binigyan lang siya ng kanyang previous doctor na as needed na medication, then I can still give once a day na medication, but it should be taken regularly for certain number of days and months. Okay?
Yeah.
But if the patient is already on twice a day of this antihistamine or binibigyan na siya ng dalawang klaseng antihistamine in a day, then ibig sabihin, hindi na kaya yan ng twice a day. Then I should step up. Kung ano yung pinanggalingan ng pasyente na paggagamot dati ng doctor, doon ako magbe-base ng treatment. So, if already, the patient is already taking that medication, that antihistamine for a week, and yet, nagpapantal pa rin siya in less than 24 hours, bumabalik pa rin nagkakaroon pa rin siya ng mga occurrences ng hives, then it's time for him or her to go back to his doctor. Kasi ibig sabihin na we need to adjust the medication or we can give additional treatment for his chronic urticaria.
Yes. So that's great, doctor. Just to recap what you said, their patients must take their medication. And if they observe that it's not enough within 4 hours or 2 days or a week, then they should go back to a doctor like you. And oftentimes, you are the second or third doctor they've seen because the medication that their doctors gave them can't manage. It should, the goal is relief from
Yes.
the itchiness, from the hives, from whatever from the discomfort and all of that. And oftentimes you will look at this, what are you taking? Okay, you can take this above that, or just take this, don't take that. And then they should always get back to you if if it doesn't work. And if the patient is also a newbie, like it's the first time they've experienced, and you're the first doctor, then you know what to give them, of course. That's how you
Yes.
start. Okay. You're right, doctor. No, a lot of patients have a habit of especially like I've met a lot of people who are like this, even with their other medications. I take it, they'll take it, they feel better. They'll stop taking it. Or
Yeah.
the rashes or the hives disappeared. I was given this for 1 week, but you have to finish it. Disappeared for 1 day, comes back the next day. And then it kind of, it happens a lot. Or if you, as a doctor, say, you need to take that for 6 months or 1 year, anyway, I'll check up on you, go to your regular checkup, or it's maintenance already, pretty much it's for life, or whatever it is, even with other medications. When they stop it, they're okay for a while. But then it
Yes,
comes
agree.
back. Okay. So
I
yeah.
usually give them a warning, Nicole, na that chronic urticaria, when say chronic urticaria, from the word itself, chronic, it also entails chronic.
Yeah.
Yun ang kaagad nung sinasabi ko sa pasyente. Because I always explain to them, ano ba yung prognosis? What do you expect with this chronic urticaria? The average duration of urticaria, chronic urticaria, is usually between 1 to 5 years, remember that?
Yes. How long can it
The average
last?
duration. Okay. But there are also some literatures that would say it can last more than 20 years. In fact, they say that the health condition of patients having chronic urticaria is almost the same to the health condition of patients having heart diseases. No? Kasi they have to really be maintained on a certain number of months of medication. So, ano bang ina-expect natin when you start the treatment? So, around 50% of those patients having chronic urticaria will already actually symptom-free after 3 months. Remember, that's 3 months. 50% pa lang sa kanila ang symptom-free na. And then, after a year, almost 80% of these patients with chronic urticaria ang actually symptom-free. But then, there are still a certain percentage of patients, like around 11%, will still be symptomatic even after 5 years. That's why we usually monitor the patient. No, when we give it for 1 month, you have to come back to your doctor. Kasi we have to assess, do we really have to continue or step up or step down based on the treatment we gave to the patient.
Okay. Yeah, thank you, doctor, for that, and coming back to the doctor to check up, because well, that's amazing. I was gonna ask you, how long does it last? How long can it last? And you said usually 1 to 5 years, but there's
That's the average duration.
average. That's the average duration. But there are some cases when you read literature, and I know doctors, like, you always keep up with the latest things and what's happening. And especially you're treating something that has to do with the immune system, there's some that can last for 20 years. So if you stop without telling your doctor, you can be good for a while, but if it comes back, actually, you get patients like that they come back like,
Yes, yeah. Actually, in patients, those patients who had chronic urticaria in their life, no, sometimes they will ask you, babalik po po ba ito, no? Do I expect this to come back pa in sometime in the future? Yes, around 50%, di ba, kunyari, nag-treat tayo ng chronic urticaria for 6 months, no, 6 months, and then you're free. Wala na, di na bumabalik, no? O di masaya ka na, pero if tatanungin mo din naman ako, no, I still give you that data na around 50% of these patients then na pwede pa rin siyang bumalik in the future. But sometimes what I see in my clinic, when they do come back, hindi na siya kasing grabe din ng previous na mga reactions niya or the presentations.
Doctor, I've seen or observed that there's someone I know, she tends to get allergies. Not me. It's really not me. A friend. Yeah, really, it's someone I know though. But she tends to get allergies at a certain time of the year, and she gets urticaria or angioedema, and then it's really pretty bad for a couple of months. And sometimes it's not the exact time of year, but it's sort of within a 2-month range, of that time. So, yeah, I mean, is that, and then she gets medication, but after a while, no more na. Is that something like, should she go see someone like you?
Yeah, of course. Baka hindi lang, Nicole, baka hindi lang hives ang kanyang presentation. Baka meron din siyang ibang allergic diseases like is your friend has also a concomitant allergic rhinitis or bronchial asthma and atopic dermatitis, no? Kasi we see also some patients na with chronic urticaria also, and also an underlying allergic diseases, no? Around 50% of these patients with chronic urticaria will also have a concomitant allergic rhinitis, yung merong mga sneezing, runny nose, and flagged nose. No?
Ding, ding.
Guilty. Yan. And around 20% of these patients also with chronic urticaria will have an underlying bronchial asthma. And around 8% will have atopic dermatitis, or what we call the eczema. Okay, so when you say na there are certain months in the year na talagang doon lang symptomatic siya, no, baka this is what we call, parang meron siyang seasonal allergic trigger. So baka there's something in the air, no, na in season yung kung ano man yung pollen na yon, or during that time mataas yung burden ng house dust mites, kaya siya mas active na nagkakaroon ng mga symptoms of allergic like the hives and the rest kung meron siyang allergic rhinitis.
Should the patient come see you only when they're experiencing this, or like, let's say now they're okay, should they go next year when they have it, or should they go now?
Well, anytime, no? Better nga sometimes kung wala silang symptoms, kasi sometimes if they want to know yung triggers talaga, we usually delay muna yung mga allergy skin testing. If the patient is still symptomatic, we have to control muna yung mga allergic manifestations before we do the allergy skin test or the other workup, no? That's why it's better to go kung hindi sila symptomatic, or pwede rin namang symptomatic anytime. But sometimes medyo hassle na, no, kung symptomatic na, tapos dun sila usually sige, skin test muna ako yung doctor kasi gusto ko nang malaman. Hindi naman kami makapag-skin test kasi nga active na active yung rashes niya, and we cannot do the skin test, allergy skin test, if the patient is on antihistamine. That's why we have to stop the antihistamine muna, itong mga second generation antihistamine, for a week before we can do the allergy skin prick test.
It's good you said that, doctor. I was going to ask you about the skin test and all that. Do you still do the skin test where you rub, you poke parts of the arm, and then you like like dust here, like samples
Yes.
that, and then if
Parang prick lang siya. Parang gaganon lang siya nung lancet doon sa adults, we do that just sa forearm. But in pediatric patients, we do that sa back nila.
okay, so you still do that. There was a time before when before injecting or using a medicine when hospitalized, they would do a skin test where they would just like kind of go under your skin and inject it. And
Okay.
then
Different naman yun, Nicole. No? You usually do that, yung mga allergy skin testing to the IV medications, no? But it's actually not necessarily to do the allergy skin intradermal test to the medications, no? May certain antibiotics lang, di ba yung mga antibiotics you usually
Yes.
do that? There are only certain antibiotics na kailangan i-skin test prior to administering to the patient, but not all. Hindi po yun standardized na mga protocol to do a skin testing to antibiotics.
They're not standardizing anymore. But what if the patient is a highly allergic patient?
If the patient has a history already to certain antibiotics and we need to give this antibiotic now, which is the drug of choice, then we can do an allergy skin test. Or if you want to know if the patient can safely receive the alternative medication, then we do the allergy skin testing to the medication.
Okay. And all right. Okay. So doctor, we actually have a few comments, or people text in. Hi, Nicole, super interesting topic. This is Jessica from Dubai. Okay. Thanks, Jessica. I told you the doctor and the topic. Hi, Nicole and Doc, watching you guys from London. Wow, technology nowadays. This is from 𝗵𝗶𝗶𝗶𝗃. Thank you, 𝗵𝗶𝗶𝗃 and doctor, Okay. So hi, Nick. Always cannot read the writing. When you watch, always, you've always been a fan, sorry, of your informative show from Isa Crisolico. I'm sorry, Isa. Okay, thank you, doctor, for being here because you're giving us so much information and today's topic really is interesting. Hi, Doc. Wow, I like the topic today. My son is very sensitive too. He gets allergy every day. Food, change of weather, and pollen. This is from Jason of New Zealand.
Oh, New Zealand.
Yeah, we have a lot of Filipinos also watching from all over the world. And when they come home, maybe they can get some tests in hospital like Makati Med. And then Nick, always watching your show, Maria Christine. Thank you so much. And okay, I'm happy your show is back to educate, to inform people, and also we get to choose which doctor to go to from Harpy. Thank you, Harpy. Yeah, because we interview different doctors, different topics, and then at least they know that it's not just one doctor giving a general sort of a general statement. Although your general practitioners will probably, or your family doctor, refer you to doctors like, let's say it's an allergy, they'll refer you to someone like Dr. Michael. Okay, doctor. We just have to take a quick break and then we'll be right back, folks. Hang in there or go take your allergy medicine, go, get your coffee, do whatever it is, and then join us. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. 𝗂𝗍 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Hi, folks. Welcome back to Healthline with Makati Med. We are here talking about hives or chronic hives. It's an allergy or an underlying symptom of another disease. As our guest today, allergology specialist, Dr. Michael or Dr. Maria Socorro Agawili de Jesus has told us. And Doctor, thank you for being on the show. I learned so much today, like even more. And there's one thing I wanted to highlight from what you said, which is go see the doctor. It's also good like to go when you're not experiencing allergic symptoms. Because I do remember you said usually people are on the second generation antihistamines. And I know we don't want to mention brand names here unless you sponsor us, but you know, it's things like cetirizine and
Generic lang.
yeah, generic, yeah. With the first generation diphenhydramine, that acts fast, it makes you sleepy, but I do find sometimes when it's breathing.
Short acting lang kasi siya. It's not sustained yung effect niya pag you use the first generation.
You have to keep taking it. Or basta
Yeah, kasi after 8 hours, wala na siyang effect yung diphenhydramine.
After 8 hours.
You have to take it every 8 hours. So, wala, bangag ka na talaga. No?
And it's like hours. 50 to 75 milligrams or 25 milligrams or okay.
25 or 50.
So we know what we're talking about. We know what medication, what brand name we're talking about. Favorite ko rin yun. I mean, I find that it treats things fast. Okay. So, what I wanted to highlight was that go to your doctor when you can go if you know you have a history of allergy or you've had urticaria or chronic hives at a certain point, or what do you think is chronic hives, whatever, as long as you're allergic to something, you can go to your allergologist, a doctor like yourself, and that's when you get tested because you have to be off. If you're experiencing the symptoms now and you have all this itching, your breathing is not so good, you have rhinitis, and you have asthma, the doctor like yourself has to treat you first for what you're experiencing. And when you take the tests, the more advanced tests, or go into that, you have to be off your medication, or whether it's maintenance or for 6 months or for the 1 week or 2 weeks, you have to be off that for what did you say? 1 week?
7 days lang.
7 days, okay.
For the allergy skin prick test lang, Nicole. But for the other blood test, then you don't need to stop your antihistamine.
Okay. Yeah, I did go to some doctor, not in your hospital, but afterwards I got pretty, upset because he was an allergologist, and then he said, how long have you been off the, yung like the cetirizine or whatever? And I said, 2 days. He goes, should it be? He said, it should be 3 days, pero pwede na yan. And I don't think the test came out correctly.
Yeah, it can mask kasi, di ba? You still have the effect of antihistamine. The result kasi when we do the allergy skin prick test, yung magpa-positive doon will have a hives, no? Yung parang magpapasok siya. So if you are on antihistamine, no, chances are baka magpo-falsely negative siya because it was masked by your antihistamine.
Yes. So it should have been 7 days. See, whoever that, if you're watching now, doctor, I won't name you, but
I'm so sorry.
It's not you. It's him.
No.
But, because I ate the thing, and yes, the proof is when you get the attack. And you're like, thank you so much for making me suffer again. But anyway, a doctor like you at least, will say, no, we need the 7 days. Thank you, doctor. And do you have any advice for people who are experiencing chronic hives? Could you give that advice to them?
Yeah. So for our patients, no, especially suffering for chronic hives, no, don't think that these hives, no, are just as simple as allergy or an allergic reaction lang. So even yung allergy, diba, sometimes it's scary, no? But don't think na, allergy lang yan, no? There is much for us to know kung ano yung underlying disease that's causing it, kasi it's not all the allergens causing it. It can be from your underlying illnesses, no, underlying infection, underlying autoimmunity, or even after all the workup, pag wala tayong makitang cause, then we call it idiopathic. And when we say that's idiopathic, no, ito yung mga pantal na usually difficult to treat, no? When you say difficult to treat, you need 1 or 2 or 3 or 4 antihistamines before you get the control, no appearance of rashes, or we need a longer period of maintenance of this antihistamine before these are totally controlled.
And doctor, if I may say, halatang it's obvious that you're the type who will really get into it and find out, and that's good to know. You know, because if we just that's good. Okay, doctor, you know, you are gonna see me in person. I'm just warning you.
Yeah, you are welcome in my clinic.
Thank you, doctor. Thank you so much. We're actually ran out of time, and you know, somebody made a comment, wow, Nicole, ang haba naman ng mga questions mo. I'm not even reading anything, or like whatever I prepared, it's gone. I'm just having fun talking to you. Thank you so much, doctor, for being on the show. So informative, very engaging. And would you like to say hi to anyone, or you know, when?
Okay, Nicole, actually July 8th is actually the National Allergy Day here in the Philippines, no? It was actually declared as the National Allergy Day. So that's July 8th on Saturday. But I would like to invite everyone to tune in to our 𝗶𝗍 National Allergy Day celebration through the Facebook, no? You can search 𝗶𝗍, that's PSAAI, National Allergy Day, and go to our website page. Then you can tune in to our allergy lectures for the lay on Sunday, July 9 at 2 o'clock to 5 p.m.
You know what? That's just the perfect date that you gave me.
Yes.
And tell you when,
for the National Allergy Day.
I will tell you why that is just the perfect date. But to you guys out there, thank you for tuning in. Thank you for helping me welcome. Actually, a lot of people welcomed you. Sorry I don't have time to read everything, but you know, a lot of people welcomed you, and they're very happy with all the information you gave us today. Thank you, doctor.
Thank you also, Nicole, and to all your viewers and listeners.
Okay, thank you to those tuning in. Tune in again next week, Monday, 5 p.m. to 6:30 p.m. And don't forget, you can watch us anytime on Facebook, YouTube, and all of the social media. You know how to do it. DZRJ 8:10 a.m. and 8:10 a.m. That's 8:10 a.m. Radio Bandido. Sorry, sir. Thank you, doctor, for being on the show today. It was great to meet you, and I'll see you soon. And audience, I'll see you again next week. Bye, guys.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily